Hello, good morning and welcome to Apollo 24/7's Health Hour. This is a show where we bring you an Apollo health expert every week and you can get to ask your doubts and queries on the live show. You must be watching this on my Facebook page or Apollo's Facebook page and also on Apollo 24/7's YouTube channel. In case you want to post your question, we request you to place the question on YouTube itself. Otherwise, I'll not be able to see the question and take up the question. So go ahead, type all the required questions in one go. That is your age, your gender, your problem, and what all you have taken, as much as information possible in one question, so that it's easy for me to check and place the question before an expert. And also on the show, you will be able to find some discount vouchers, and there are chances of you winning a health coupon for yourself. Please be with us till the end. I'm going to share you certain discount vouchers as well. Apollo 24/7 डाउनलोड कीजिए और आप पूरा अपोलो आपके हाथ में पाएंगे. आज हम बात करने वाले हैं डेंटल प्रॉब्लम्स के बारे में. हाउ डू वी troubleshoot dental problems at home? That's our topic for today, and we have an expert with wonderful experience, Dr. Adosh Lall, who's a senior consultant and distinguished clinical tutor, Indraprastha Apollo Hospitals, New Delhi से आ रहे हैं with more than 28 plus years of experience. उनके professional memberships हैं Fellow of International Congress of Oral Implantation, Fellow Prairie Forchard Academy, Member International Academy of Periodontology, Member Academy of Oral Implantology. He was a member of Indian Society of Periodontology, who's a diplomate in World Congress for Oral Implantology, member Indian Dental Association, and Dr. Adosh Lall can be consulted for periodontics, implants, and restorative dentistry as well. So here we have Dr. Adosh Lall. Good morning, doctor. Welcome. Namaste. Once again, namaskar. The Apollo's namaskar signature and such a wonderful way to greet. And I think, world has learned the power of namaskar due to in the pandemic times.
Definitely.
Well. Yes. Definitely. Welcome once again, doctor. It was we had your wonderful session in the initial days of the year, so it's good to have you back around the end, closing of the year again.
Thank you, Jessie. Lovely meeting you again.
Thank you. So, Dr. Adosh, there's a lovely saying in Telugu कि जो दांत में कंकर बोलते हैं हम, small stone, than the eye and the feet. A stone in any part of, or anything जो है, any disturbance in any part of these places is going to cause you a lot of trouble. But teeth, I suppose, are something that we take them for granted. Our dental hygiene or dental strength is something that we take for granted. It's only when there is disturbance to our oral hygiene or health, that's when we all understand that अरे यार इसको हमने ignore कर दिया. Do let me know what are the things that we do that we cause our problems.
The most first and foremost is कि हम ignore कर देते हैं कि हमें every year we must go for a dental checkup. Because yes, if you were to go in for a dental checkup, the dentist generally what they do is across the world, we start with a procedure called dental cleaning or scaling. So when a dentist is cleaning or scaling you up, anything small is identified and then taken care of in the due course of time if wherever is needed. बट अगर आपने क्लीनिंग ही नहीं कराई या आपने अपने रूटीन साल भर के जो एनुअल एक्सरेज है वो नहीं करवाए तो पता नहीं चलता है. जब पता नहीं चलता है तो वो इग्नोर हो जाता है. वंस इट्स इग्नोर्ड it leads to what we call is a very acute pain or a dental emergency, which is generally when the caries or the decay reaches the nerve structure, and that is very severe pain which patients suffer later. So as the old adage goes, a stitch in time saves nine. वो अगर आप पहले क्लीन कर ले to start with, या अगर if it has become a cavity, you fill it up, and that will take care of things.
So a filling in time will save you root canal early.
In the longer term, yes, it will.
In the longer run. Okay, while I'm seeing my audience who have already started to join and pour in questions, welcome all of you. Thank you so much for putting all your questions there. Nitish's question I would want to take up first. Nitish is 35-year-old male hai. How can we clean behind yellowness of front teeth from inside? Okay. how can we clean behind? Yellowness of front
Yeah, I
teeth
get.
from each.
I've understood. I've
Is there a
understood.
negative
So
impact
basically,
of teeth scaling or cleaning?
okay. The first thing is that the only way you can clean behind your teeth is by taking your brush in in a horizontal manner and rolling it upwards, so that you kind of clean all the debris which accumulates in front of your tongue and in behind your teeth. Now, there is a reason why there is maximum amount of deposits in this area. We have a salivary gland, and that salivary
Yeah.
gland produces saliva, and that saliva opens into our mouth through a duct. The duct का जो orifice है, where it comes, is right behind the front teeth. So there is maximum accumulation of that yellow debris that he was talking of in front of our lower teeth, not front, at the back of our lower teeth.
Back of the
And the
lower
other
teeth.
place, yeah, and the other teeth, the other area where it opens is your upper teeth on the outside, not inside palate, but on towards the cheek, your back teeth. So दो जगह पे saliva निकलता है, और वो saliva वहाँ पे सबसे ज़्यादा deposit होता है. So when we are brushing, we must be careful that we lay emphasis on these two areas more than the others.
While you're answering about scaling and a visit to a dentist might show कि यहाँ पर deposits हो रहे हैं and then ignore करने का chance नहीं मिलता है. How
नहीं,
often
और
should
वो
one have a scheduled visit?
the cleaning is that's the whole idea. The book says that you should do it once in 6 months, but how Indians are at least once a year. And the second question was, he had asked if there is any deleterious effect. No,
Correct.
there isn't. It's a myth कि आप cleaning कराएंगे तो दांत ढीले हो जाएंगे. It's let me give you an analogy. In the West, we have dental insurances, and anybody and everybody has a dental insurances goes to the dentist twice a year. So let's say that
Okay.
anybody has spent 10 years in the western part of the world, 10 साल में दो बार, हर साल. So
हर
in
साल.
that makes it 20 times. So in 20 times तो दांत हाथ में आ जाना चाहिए. If that myth was true, it doesn't happen.
अगर
It
वो सही होता तो, yeah, that was true.
But then what I would also want to emphasize is that uh, if you're brushing, if your dentist has not taken care of the fact that you have gum disease and your teeth are already loose because of gum disease, and then you scale those areas, yes, then the teeth start shaking more. So
Okay.
generally, my team and myself in particular, we are very careful that when you start getting your cleaning, make sure that your dentist tells you if you have gum disease in advance before he starts the procedure. In case not that everybody has, so if you don't, then you don't need to worry.
ग्रेट. सो नितेश अग्रवाल जी, आपका क्वेश्चन आंसर हो गया है एंड थैंक्स. आपके आपके क्वेश्चन की वजह से हमारे क्वेश्चंस भी आंसर हो गए. The next question is Blaze Luna. Good morning, doctor. I'm 42-year-old female and I noticed that there is a space development in my upper and lower teeth. What to do to fill up these gaps? And why do these gaps occur?
So, what I would want to ask the patient is that are the gaps increasing? If the gaps are increasing progressively, that means that the tooth is losing bone support. And if the bone support is going, that means and the gaps are coming because of that, which generally happens. Then that is because of a particular disease or entity called periodontal disease. That would have to be handled by a periodontal surgeon or a periodontist to ensure that whatever bone loss has happened has to be arrested and stopped. What has what is it's like what milk has spilled, don't cry over that. Just make sure what is left, you kind of take care of that. So we try and ensure that the bone loss which has happened generally doesn't come back. Very rarely can we use artificial bone grafts and augment that areas, but anteriors, मतलब सामने के दांत में जहाँ आप बोल रहे हो वहाँ तो थोड़े कम ही चांस होता है for the bone grafts to work. It rarely does, but it can. Um, the aim should be what is lost, try and ensure that it doesn't go any further. The
Okay.
the
So
bone
Blaze,
loss should
I
not
think
go
this is
any further.
Yeah, Blaze, I think this is the time that you keep a notice on what Dr. Adosh has mentioned कि ये बढ़ रहा है या किस reason से. Go visit your dentist right away. Make an appointment in case you want Apollo 24/7 to help you. Right now, Apollo 24/7 is also in the comfort of your home. Right from WhatsApp पे भी आप consult कर सकते हैं. There's a number which is running through. There's a ticker 9355247247. You could use this service as well. Thank you for answering that, doctor. So, doctor, I would want to understand कि हमारे हाथ में क्या होता है जो हमारे practice, hygiene, oral hygiene practices क्या है that you want to emphasize on?
Brush, brush, and brush. So normally I tell my patients, normally I tell my
Yeah.
patients, uh, brush after dinner, brush after breakfast. Before breakfast, if you wish to do it, you're most welcome, but it's more important that you brush after breakfast, after dinner. The idea is that the teeth should be clean after your meals till the next meal. You can maybe avoid your brushing lunch. You don't need to because that would be excessive. But दो meals के बाद अगर आपने brush कर लिया, which is a 12-hour cycle, you would prevent the plaque from forming on the teeth, and that would eventually save you from most of the gum diseases and teeth problems. In addition to brushing, the second most important thing which I teach everybody or my patients is you must uh, clean in between your teeth, the interdental spaces. Those are as important as your front and back surfaces, which all of us are clean. The interdental spaces are what we ignore most of the times, and that is something which should not be done because they are as important. And as we age, gaps between our teeth increase, food accumulates between those gaps, those interdental spaces are ignored. Once they're ignored, the food stays there. It eats off the tooth, eventually reaches the nerve structure, and it leads to a dental emergency. So
Right.
that's point number two. Point number three is your tongue brushing. Every meal, you don't have access to your brush. Roll your tongue
Hmm.
all over. When you roll your tongue tells you यहाँ खाना फंसा है और यहाँ नहीं फंसा है. जहाँ फंसा है वहां से निकालिए. एटलीस्ट वो तो करिए अगर आप इंटरडेंटल क्लेंजिंग नहीं कर सकते. सो नॉर्मली the answer to the question which Jhansi asked would be interdental cleansing followed by toothbrushing.
So, any particular products, hygiene products that you would say interdental cleaning के लिए?
Interdental cleansing aids तो बहुत सारे हैं. There are so many interdental cleansing aids. So they are like a glorified toothpick, which is like a miniature bottle brush. So if there are young people, the contacts between the teeth are very tight, and all you can do to clean those interdental spaces is use a dental floss. Dental floss is like a tip. It's like a thread.
Correct.
It's a wax thread, and it helps to clean. And you'll realize once you use the floss, suddenly it's like a wow feeling because you realize that वो जगह तो मैंने कभी साफ ही नहीं करी थी, and it gives you such a good, good
Correct.
a feel good factor. And after you've done the interdental cleansing, then you go on to your regular brushing, which helps. So
Great. So,
brush,
yeah.
interdental aids, and that's it. What toothpaste you're using really doesn't make a difference.
Yes, yes, we did talk about this in the last session extensively. कि कौन सा
Yeah.
toothpaste or कौन सा brand, the specific role toothpaste and all that doesn't matter is what you gave a call last time. So here,
It's how
Mr.
you do it is
Srinivas.
more important.
Sorry, doctor, please come again.
It's how you do it which is more important.
Correct. So Mr. Srinivasan is asking the next question. While we are talking about brushing and importance of brushing, despite brushing twice a day and cleaning tongue daily, there is still odor from mouth. Why is this happening and what's the solution? This is a common problem. And what does it indicate?
Okay, so malodor or foul smell from the mouth can be because of a multitude of reasons. If it is because of the mouth, our body is a full system. Now, it could be because of your stomach acidity. It could be because of an infection in the chest. It could be a problem with the kidneys. Everything will come out through the mouth. The smell will come out through the mouth. Next, if it is through the mouth, it can be because of two, three reasons. First, uh, the most common is a dry mouth. If it's a dry mouth and you sip water and the smell goes away, you found the problem. Second is
Correct.
clean your tongue. see if your tongue is coated. Sometimes a coated tongue can also, especially when we get sick, if you've noticed the tongue gets white, and that can cause, a smell coming from the mouth. Clean your tongue with a soft toothbrush, not with the tongue cleaner. Gently just use the bristles of a soft toothbrush. I come across patients who say that we use those metal tongue cleaners. I don't advise those. Don't use those. That's a bit too aggressive for the tongue. Not needed. And the last reason, not the least, it is most important, is cavities in the teeth. If food is accumulated, that can cause smell. So if there is no food accumulated, or in between teeth, as I said, interdental space में खाना फंसा है तो वो आपको smell दे सकता है. And one more reason is gum disease, periodontal disease.
Exactly.
If the patient has periodontal disease, that gives you a very foul smell. So that, as I said, your gum specialist evaluation, periodontist evaluation will let you know if you have that particular problem, and that is giving you the gum disease smell.
Yes, yes. So while we talk about periodontal disease and gum issues, Rajiv is asking this question. Hello, sir. If gum decays, will it rebuild by using medicines? So, क्या है, कैसे address करते हैं? What are the gum diseases that we can avoid, and how do you treat them?
I haven't really understood the question. You said gum
Rajiv
disease
says
because of.
if the gum decays, will it rebuild with medicines? Rajiv is asking.
No. The gum decays or gum disease or periodontal disease or pyorrhea, they're more or less the same. And medicines will not help. It will only try and control the infection that has happened. But you'll have to find out the cause that is leading to the gum disease and address the cause. आप दवाई खाएंगे तो दवाई तो वो इन्फेक्शन को ठीक कर देगी, बट आपने कॉज को हटाया नहीं, so that will rebound and it will come back. So you aim at correcting the gum disease. As I said, what has happened or decayed, you can't possibly sometimes get it back. But if you can stop it from progressing, you'll save your teeth from getting loose and losing your teeth eventually.
At this point, I would want you to throw some light on the common gum diseases and tooth diseases as well, doctor.
The most common, so in the mouth we have the tooth and then we have the gum around it. If it's a tooth and it's got a problem, that means it's got a cavity, and
Yeah.
or it is got worn out with age. Sometimes there is excessive wear out also because of a multitude of factors that is causing the tooth structure to be lost. So you'll either have to restore the tooth which is lost physiologically because of age, or pathologically because of a cavity where food was getting accumulated. So this is the tooth part. Next you have the gums. Gums can, the most common disease that you come across is bleeding in your gums, and that can progress. Like say bleeding hai, aapne ignore kar diya and this is progressing. It can progress to eventually the gum has bone underneath, that bone gets lost. There is bone loss. Bone loss can lead to mobility and eventually, as I said, tooth loss. So these are the common gum and teeth diseases that we can come across and which can be addressed by going to the dentist maybe
That's
once a
it.
year.
Yeah. Okay. So here's next question. Nikki is asking. Her name is Konda. Age is 47. Can a heart patient with a stent go for a root canal for upper tooth?
Yeah, definitely he can. A heart patient with a stent basically is on a lot of blood thinners. Now, any surgical procedure or maybe even a procedure like cleaning can cause a lot of bleeding. Now, these are procedures which should be avoided, but root canal is within the tooth structure, and you're doing a root canal because the nerve structure in the tooth is necrosed or dead. So when we're doing a root canal in a procedure who's had a stent earlier, it's not really contraindicated. On the contrary, it can be done very easily. Yes, you should speak to your cardiologist, keep him in the loop, ask him his choice of antibiotics if he wants to start any before the procedure, and go ahead and do it.
That's wonderful. So it's one cause, or sorry, one problem should not stop the other problem. This should be addressed as well. And there are experts coming together to take help. Please do take help and do consult the right kind of doctors. You want some help with that? Apollo 24/7 is always there. Next question is Lalit's question. Age is 23. Sometimes I feel pain on the the tooth which is done with RCT. What's the reason?
Pain in the tooth which has undergone an RCT. So if the
Exactly.
RCT has been completed and patient is encountering pain immediately after the procedure, that is because the root canal procedure is basically a minute, or I would say a very microscopic or a minute level surgical procedure wherein we remove the nerve structure of the tooth, we widen the canals of the tooth and clean it and fill it up. Now, all this will cause inflammation or swelling under the tooth where the nerves are still alive. It's only the tooth which is being treated, but then the structures around the nerve structure around the tooth, which is the bone, that gets inflamed and that causes pain. If you've had a painful root canal experience, then generally it takes sometimes 2 3 weeks for the tooth to get absolutely normal before you can experience no pain and you can start eating. In
Right.
case you feel that you got the root canal done, let's say a year, 2 years, or 3 years back, and still it is hurting, then you need to identify either there was a lacuna in the root canal procedure that you got done, which was not maybe inadvertently or by chance missed, or a particular procedure was a particular canal was missed, or it was not completely filled. So those things can cause pain. Or also, a very common thing that I see is food gets stuck after the cap is made between the cap tooth on which the root canal was done and the one next to it, and that can cause pain. So it is the adjacent gum area which is hurting because of the food lodgement rather than the root canal. So all these things can be addressed to see what's happening.
Great. So, in continuation with the root canal question, Pavan Kumar's question I would want to take up. Molar teeth have deep fillings. Every dentist that I visited is advising to get a root canal immediately, but they are. It's been 10 years. If I get a crown put, and in case root canal is needed, then implications. I'm not sure if I've understood the question and placed the question properly. I'll read the
I
question
think
again. Yeah.
I think I've understood. What he's saying is that dentists have advised him root canals on a tooth
And
which
he's
has got a
waited
big
for 10
cavity,
years. Yeah.
and he's not got it done, and he's still got no
It's
pain,
okay.
and he's asking if he should get a crown done directly. Am I right? Is that what he's saying?
Yeah, that's it,
Uh,
ma. Yeah, if I get a crown put in case root canal is
yeah.
needed, then
No.
implication.
So what we would generally do is when a patient like this comes in, we would first take an X-ray, identify the extent of the decay. If the extent of the decay has crossed to the third layer of the tooth, the first is the enamel, the second is the dentine, and the third is the pulp or the nerve structure. Now, if your decay has reached the nerve structure, then you should not be putting a crown
Great.
over it, because uh, you are surviving or not experiencing pain because of the fact it is open. It hasn't been filled. The minute you put even a temporary filling on this tooth, the tooth flares up sometimes. I mean, it's not necessary that will happen, but majority of times it does happen, and then it could cause severe pain. And the cap or the root canal that you've got, the crown that you get done, it can it will be wasted, because to do a, let's say that you put the crown on a structure like this and it starts hurting, then what choice do you have? You'll have to take the crown out, destroy the crown, or sometimes people go through the crown and do a root canal which is absolutely not visible. So if
Okay,
you're going in, you're investing money onto a crown, my suggestion is make sure that the tooth underneath is healthy and strong.
great. I think the next question that I would want to ask is something similar. Hey, where did I lose the question I wanted to ask? Priya Gopinath. Priya is 30-year-old. The back grinding teeth, both upper and lower, are mostly affected with tooth decays. Can there be anything used as a cover to protect it from getting decaying further?
After a root canal is the question?
No, no, there's no root canal involved here. She's not asked anything
No.
about RCT.
So generally, if you I mean, I don't advise crowns on teeth for longevity of the tooth structure. It doesn't make sense. See, when you make a cover, as you were asking, a cover is basically a crown. A crown is made on a tooth only when you have um, created space for that crown. Imagine a hair comes between your teeth. You don't feel comfortable. A thin hair when it comes
Correct.
between your teeth. A crown is about 1 to 1.5 millimeters in thickness. So how do you get that 1 millimeter or 1.5 millimeter thickness? By reducing the crown, by reducing your own tooth. So when you reduce your tooth structure, it is only then do we create space for a crown. So to say that when I make a cap, it will last longer, no, first you're destroying the tooth by creating that space on all four sides, top and the sides, and then you put the cap. So yes, you're covered. The cap, it sounds like as if you've got a cover and my tooth will last longer. That's not an ideal situation. I would not advise that or tell patients to do that.
Okay, so so that's not the solution, but further
Not
decay
the solution.
stop करने के लिए कुछ होगा?
Further decay stop करने का, the first thing you need to do is restore the tooth with a nice composite or a filling material, and keep the area clean. The cover is not the solution. You cover it means you first taken off 60% of the tooth, the healthy of whatever. First, the tooth is lost because of the cavity. On top of that, to make a cap, I'm taking away 60% of the tooth structure and then putting a cap. तो वो 60% तो चले गए. You lost more than what you started with. It does not make sense. There are newer techniques wherein you do onlays to kind of just cover the part which is lost. That is something which you could try. An onlay would be more suited, but then first the decay and then go in for the onlay that a ceramic onlay or a composite onlay, and those things will help.
Yeah. So here our next question is regarding implants. Satish Arora wants to know how painful the implants are or the procedure is. And then Mr. Mahesh Goel says 57-year-old. Is implant safe and is it painful? How much does it cost?
Um, okay.
First of all, I
Painful
would
is
want to know why is it necessary? Why, when does a dentist think that this is necessary to have an implant? What leads to it?
when you don't have a tooth, you can replace it in three ways. You can use, let's say that you have a tooth which is lost and you want to replace it. You can replace it with something removable, which is like a denture. It could be a partial denture or a three-fourth tooth denture or a complete denture. Partial denture means one tooth loss, you replace it with a denture. That is the most cheap way of doing it. But then you have to remove it every day and wear it during the daytime and take it off during the night. So some people don't like it, and obviously your mastication is not restored as well with a denture that an implant will replace it with, or your own tooth helps you eat with. Next is a fixed option. The fixed option is wherein you make a bridge or make multiple caps and join it. But then, as I was explaining in my last question, when you make a bridge or when you make crowns, um, you are doing it at the expense of healthy tooth structure. The adjacent teeth will lose about 60% of their own tooth structure to give you a fixed tooth there. So implants were devised many decades ago so that whichever tooth comes out, it is replaced by a dental implant and you have a crown on top. So the dental implant is in lieu of the root which was taken out, and a crown on top is the crown or the tooth with which you eat. Next question was how painful.
Painful.
I I'm coming to that. Taking out the tooth is a painful procedure if the patient is not anesthetized properly. If the patient is anesthetized properly, you don't feel when I extract. The only thing you feel is pressure, because that is something we cannot stop. Whenever we give an anesthesia, it takes care of the pain. It does not take care of the pressure. So the people confuse pain and pressure amongst the two. It is the pressure which is happening. So normally, when I am treating my patients, I elicit what is pain and what is pressure. So once the patient says there is no pain, only then do you go ahead. Coming to the painful part, which people normally get scared about. Once the tooth goes out, which is under anesthesia, ideally, if it's not an emergency, because there are times when you want to immediately put an implant on the same day, if given an opportunity and you have the option, I normally tell that get the tooth pulled out, so that part is done, let it
Okay.
heal, and let the implant go in healthy bone or a healed area. That is generally absolutely not painful because you're entering healthy bone, you already have space, and you're putting the implant in. And my patients generally come back to me that we just took one painkiller on the day that you did the implant procedure, and after that, there was no pain. So that is not because I'm doing jadoo. It's because you have let the body heal. You are entering into a healed area, and when you enter into a healed area, the pain and the inflammation can be controlled by the operator or the dentist by being very gentle. That's it.
Right. So it's the time that heals and take time between these two procedures is what you advise. All right. So the cost varies, and then there must be a lot of
Okay,
other
now
options.
the cost would vary on two things. The first would be on the operator's experience, because I'm sure a senior dentist with lots of experience would obviously charge you more. So the operating fee would be more for a senior dentist, and a younger person might charge you less. And the second thing that normally affects the cost also is the kind of dental implant used. There are certain dental implants in the market which are very cheap, and there are certain implants which are a little more expensive. So,
Okay.
operator fee and the kind of implants
Implant.
will determine the
Yes.
total cost to the patient.
Great. Thank you so much, Dr. Adosh there. And next question is a registered user's question. Zulkef Kolombowala, 73-year-old male. What will help me to maintain dental health after the age of 70? For example, loss of dental enamel and teeth breaking piece after piece.
Um, Dental enamel loss is generally because of one, because of excessive brushing. Two, because of excessive load. Means there is excess load. Let's imagine that. Okay, so first, excessive brushing. Don't do that. Don't use a hard brush. Use a soft brush, please. Hard brushes or medium brushes are only to wash clothes. They don't. You don't use it on your teeth.
Very well said. So
Now the
use a
next
soft
next
brush.
thing. Yeah, please use a soft brush
Yes.
and be gentle when you're brushing. Don't make your arm go like this. Break your forces at the wrist. So it's one-fourth forces less if you're breaking your forces. If your arm or wrist is moving. Whereas if you're doing this, it is a lot of. Next comes your age-related loss of enamel, and age is something which you can't control. The third thing is definitely because of excessive load. Let's say that a person who's in his seventh decade of life is got less teeth on one side and more on the other. So he'll generally use the side which has more teeth,
Correct.
and that side would obviously wear out faster because he doesn't have teeth on
You-
the other side and he's loading up the other side more. So please make sure that you have teeth on both sides. If you have less teeth, in addition to that, you also have excessive load because of your bite being. Now, what happens is when you lose enamel with age, your biting, uh, your biting
Capacity.
pattern changes. Your biting pattern
Pattern.
changes. Yeah, the pattern would change because initially all your teeth used to meet and the load was distributed on all the teeth. Now, because biting pattern has changed, certain teeth are getting worn out faster and certain are not. That is because one, those teeth are not there in that area, so the load is going on to the other. And the second is you kind of bring your jaw forward or you try and eat with the teeth which are left. So you have to address those problems. So you need to go to a specialist who can uh, kind of evaluate where all teeth are not there, which side is getting load more, make sure that the load is distributed again, and he has all the teeth in place.
So, continuing senior questions, Krishna Kiturji is asking for diabetic senior citizen के लिए what is the best full denture?
Diabetic senior citizen के लिए best full denture. If you have uncontrolled diabetes, then of course I would suggest that maybe just a removable denture is fine. But then today people want their teeth back, because obviously with your denture you limit your eating to soft things. You can't have everything like you did when you were younger. So if you're fine with just eating soft things and removing the tooth and wearing it, then that's an option you can choose. But if you feel that you want your own teeth back, then definitely you would have to get an implant supported denture. Even if you're diabetic and your diabetes is controlled, it really doesn't make a difference. But if your diabetes is uncontrolled, then it becomes difficult for the operator or the dentist to, surgically work on you. Controlled diabetes is not a contraindication. You can go in with whatever treatment you can afford.
Wonderful. Here's a younger question, 19-year-old who's asking, how frequently do I need to change my toothbrush? And somebody else who's asking, how many times is it absolutely necessary to brush twice daily? Younger people do
Uh,
have these. अगर हो
I
सके
understand.
तो
So first question
let's
was
do
that how many times do I brush?
how.
So as I explained, brush twice after dinner, after breakfast, because that's when plaque accumulates. So let's say that you've not brushed in 12 hours, plaque becomes so adherent that it is difficult to remove from the tooth surface. So normally I say that if you can, you must brush after both the meals, breakfast and dinner. Let's say that you're not, then you'll have to be extra zealously careful, and you'll have to be sure that you have a good genetically strong tooth structure. Let's say that you have a genetically weak structure of the tooth, and on top of that you're brushing only once, or if you have a very high caries index, means you develop cavities very fast and you still want to brush once, it won't go. There are people who can get away with brushing once, but that's because one, they are genetically got a good tooth structure, and two, they have a very low caries index, means they don't have any cavities in their mouth. They can do it. But if you have caries, you have cavities, and you are running to the dentist every second day, and on top of that you want to brush once, I would not advise that.
Yeah, and changing the brush frequency.
Changing the brush frequency, maybe normally what I tell is that monitor your brush. The brush bristles should be straight. If they're fraying away, they've opened up, you need to change it as early as you see them fray away, because once the brush's bristles have frayed, they can cause enamel loss like the gentleman asked at 70 years what. So if the brush is fraying away because of your excessive pressure, you'll have to change it as soon as that happens. But in an ideal situation, 3 months is when your brush should be changed, irrespective if the brush's bristles are fraying or not. So monitor it yourself, looking at the bristles, how fast they're going away. But 3 months is the ideal time to do it.
Yes. Mahesh Goyal ji, आपका question डॉक्टर साहब ने आंसर कर दिया है when we had talked about the implants, the cost and etc. Please go through it. In case you've missed the answer, do go back after the live session. The recording will be available on the channel and you can find your answer there. Next question is Amy. Amy is asking how often a diabetic person needs to carry out tooth cleaning. Is it advised on them, doctor?
Yeah. So the principle will remain the same for non-diabetics as well. For diabetics, all the more, because you will have to be, and you'll have to make sure that your oral health is absolutely perfect, because let's say there are deposits in the mouth that can affect the sugar or blood sugar management to a certain extent. People who have gum disease, or whose mouth is not, oral hygiene is not proper, their sugar management or their blood sugar levels control can be affected. So twice a year, irrespective of where you are, if you get that done, and if you could possibly get it done by a periodontist, it will still help you further to make your gums absolutely healthy, and in turn, your sugar would be also well managed.
Wonderful. Here's next question from Mr. Vishal Kumar, who's 28-year-old male. How how can oral submucous fibrosis be reversed? Submucous fibrosis.
Uh, Depends on the level of submucous fibrosis that he is. Um, Sometimes stopping the reason to start with. The reason, the abuse that the person was carrying out, which led him to submucous fibrosis, if he has stopped that, that's first thing to do it. It's a very slow process. Please have patience, don't expect miracles, nothing works immediately. So if you have submucous fibrosis and you developed it because of a particular bad habit, first thing, kick the bad habit, have patience. Two, there are certain medicines like antioxidants which help. Three, there are nowadays, haldi, curcumin tablets have come in. You could go to an oral medicine specialist, diagnose yourself as to what level of submucous fibrosis you have reached. They would advise you to go for these curcumin tablets. They can help. If it is very severe, then there are sometimes you have to go through a surgery.
Done. So while you're talking about haldi, I was thinking that ये घरेलू नुस्खे जो हैं, I think we should talk about them. In pain or in management, what are the home remedies that general practice में आपके नजर आते हैं, and what do you recommend and what do you say that this is not right, and what are the things that we should stop immediately?
घरेलू नुस्खे, after you've brushed, you could possibly, आजकल oil pulling लोग करते हैं. That helps. It has been scientifically proven that oil pulling helps. Then let's say that आपको बहुत ज़्यादा दर्द हो रहा है and आप दवाई नहीं खाना चाहते हो. In that case, you could maybe try chewing on cloves. Not, do not put clove oil, which is locally obtained from the market, because that can burn your gums as well as the inside of your mouth. But you can definitely, the same thing, if you were to chew on cloves, those cloves, long जो होता है, वो आपको दर्द को दूर कर सकता है.
Yeah.
पहले जमाने में
But
लोग
that's
दातुन
not.
यूज करते थे.
But that's not the solution. It is just a
That's not the
temporary.
solution.
Yeah, that's not the
That's
solution.
like yeah, yeah. So nothing can replace brushing or interdental cleansing. घरेलू नुस्खे मुंह में एक ऑयल पुलिंग जरूर, नाउ इट हैज कम इन, you can do that, but that is in addition to your interdental cleansing followed by brushing and pulling. You can do that. Oil pulling
Yeah.
can be done. There are various oils in the market which have been advised to be used, can be used.
Yes. Shabarish and Lavanya, both of them are asking about charcoal toothpaste and also salt. Can I use salt and charcoal for brushing instead of the modern paste? Shabarish is asking.
No, these scientific toothpaste are, the modern toothpaste have been manufactured based on an abrasive index. Salt, baking soda, charcoal. Imagine how abrasive they are. They can just take the enamel away very fast. So I don't see the reason why you should use that.
Yeah. And how about the charcoal toothpaste that are being sold?
You can, because charcoal toothpaste is maybe uh, predominantly toothpaste. Basically, toothpaste is nothing but a soap to, kind of wash your tooth easily. Whereas charcoal is, it's a very minor element of charcoal. So the company would have scientifically researched before they introduced charcoal. Unlike using charcoal locally available and brushing it
Yeah.
with it, because that will just take your enamel away.
All right. So, next question is Rakesh's question, 47-year-old, and he's got a bridge done. Should I restrict myself to soft food, or can I also have semi-hard food like nuts, etc.?
No, if you've got a bridge made, those bridges have the strength of your own tooth, or sometimes even more. if it's a metal bridge or if it's a ceramic bridge, those ceramic or metal-free products that we use to manufacture the bridge can take the load of whatever you want to eat. I don't see why you
Yeah,
should not eat anything.
great. So point blank, नाम नहीं दिया है, age नहीं दिया है. Is there a cutoff age for implants and root canal treatment?
No, none whatsoever. You can do it at whatever age you want.
That's interesting. So it's depending on when you have to get it done. So there's no age restriction.
See, it's very rare that a young person would come for a bridge or an implant, unless he goes through an emergency trauma. So then it's different. Of course, he has to go in for. Generally, people only in their later decades of life would come to me for replacing teeth. So I would, unless you got medical complications which do not allow me to work on you from the dental standpoint, I don't see any reasons why any age should be a deterrent to do dental treatment.
Yeah.
Because
So,
remember that if you're not treating yourself dentally, you end up using your stomach to chew what your teeth were supposed to do, and that doesn't work. So you'll develop other problems because of that.
So yeah, digestion and other related issues would crop up. So while you're talking about the pain which gets unbearable and then you have to rush, we have my sister is a dentist in the family, so I keep seeing her office full of patients who have come running in the middle of the night, calling in the middle of the night with pain, unbearable pain. So what makes this kind of emergency at home that I'm unable to manage the pain, and is this my own behavior? Did I let it go on till that? And how do we handle such kind of urgent requirements of dental procedures?
So generally, if there's a small cavity, which was cavity will not hurt you till the time it becomes very deep and it reaches the nerve structure. If you recall the earlier part of the conversation, we said that if you were to go to a dentist every 6 months or a year, if he and he does a cleanup for you and takes X-rays, you would get to know if there's a small hole or
Change.
a chip which is the tooth is chipped, and that part can be restored back with just a normal filling. You would have heard some people say that fillings lasted me 20 years, and some people say that filling didn't last me at all. That's because the filling was very small and 90% of the tooth structure was there. Whereas there you came, let's say you ignored it for a few years, and you come in at a time when 90% or 60% of the tooth structure is gone, only 40% left. There's no place to hold the filling. It'll keep coming off. Now, when the filling or the cavity becomes big, it reaches the nerve structure, and that causes severe emergency. And generally, patients um, complain more during the night. That's because when we lie down, the intrapulpal pressure increases and the pain becomes unbearable. So the pain, if you feel that you are experiencing pain when you lie down, don't wait till the first, second, or third night till the emergency happen and you can't bear it. Because first night, what patients do is that they'll take a pain medicine and वो ठीक हो गया, and then they'll next day they'll ignore it. Next day again it happened in the night. You took another tablet, and again it became okay, and you ignored it, and you. So this continues. By the sixth or the seventh day, the tooth is giving you, a
Enough
reminder that you
warnings.
need to treat it. Yeah, and you are ignoring it because you're doing whatever. So one day, when the body is unable to heal on its own, or with the help of the pain medicine that you're taking, it becomes overbearing, and then the pain is so severe that you'll have to rush to a dentist. In that case, what you could do as an emergency bailout is that you could chew on gloves. You could have that pain medicine, and if while you're lying down, if it's hurting too much, you can put your head up, or you can sit and sleep. That kind of takes care of few hours, so that the dental office opens in the morning and you can go and yourself treat.
Great. So that's one
So
troubleshooting tip that you've given for a dental problem at home and in the middle of the night. Thank you. Yeah, and here's next question. Divya Prasanna, 21-year-old female. After having my second child, I am suffering from severe toothache when I consume sweets or cold items. Sensitive ho gaya, especially my the last teeth. What can I do about it? And it's been a year. Does pregnancy or childbirth have some impact on dental hygiene and health?
So during pregnancy, the hormones in the lady's body get warped, and that can affect your gums. Directly, they cannot affect the tooth. Pregnancy does not affect the tooth, but it definitely affects the gum if the hormones are not in place and you have something called those deposits which are happening in your mouth which you have not taken care. So if you have the deposits, you have not taken care of it, your gum is getting diseased, and you're going through a pregnancy, that could cause certain problems. Directly tooth getting affected is not reported so far. What could have happened in this particular case is that, generally, ladies when they're pregnant, they say that once the pregnancy is over, I'll get myself treated. Little do they realize that after pregnancy, when the baby is small, it's not easy coming to the dentist.
Yeah, very difficult.
So normally my advice to all the ladies who get into pregnancy would be, make sure that when you're planning a pregnancy, before you plan one, if you do, go to the dentist, make sure your dental problems are taken care of, because if you do that, then you don't have to run to the dentist. Now in this particular case, she said her last tooth, so I'm assuming that her last tooth is the wisdom tooth. Wisdom teeth are generally in an area which cannot be cleaned very well, because they are placed in a position where brushes don't reach. So it's like it's a cycle. You can't brush it very well because
Brush,
it's not come
it
out. It's
increases.
not come out. It's stuck. It's got a cavity. That cavity is initially getting responding, or getting flared up because of your sweets, and giving you a signal that it needs a filling or it needs to be pulled out if it's a wisdom tooth, and you ignore it, it reaches the nerve and then it could become an emergency. So please go to the dentist. You could be careful while taking an x-ray because you've got a child
Yes.
in the womb. So be careful of the x-ray. Take your permission, get the x-ray done, and see where your tooth is, how much it is affected. Either you need to extract it or you need to maybe just fill it up. The second trimester of pregnancy would be the best time for treatment. So this is something that pregnant women should take care of.
All right. So next question is Papiya Datta, 39-year-old. One of my tooth has broken into a very small part. There's no pain, but what can I do? Must be a chip.
Uh, if the tooth is chipped and it is sharp and if it is lacerating your tongue, you would need to restore that with a filling material. A dentist would be able to restore the chipped part with a filling material so that it doesn't first hurt your tongue, and the filling would restore the function back to its. That's the first. If it is grossly broken, then you might have to go in for an on-way, as I had said earlier.
All right. So gum disease and this silent appearance of gum disease. Ishan Singh is 38. I don't have bleeding in my gums, but I observed that there's gum depletion. What's the reason, and can I stop this?
There is gum depletion.
Depletion.
So, when you say gum depletion,
Basically, I think it's receding gum line, maybe.
yeah. So if your gums are receding, means the bone underneath is also receding. So you need to identify why is the bone depleting, and obviously when the bone depletes, the gum over it will also deplete alongside. So we need to identify as to why the bone is going, and if you have any kind of gum disease, if that is causing it, my suggestion would be that make sure that you arrest or stop the bone loss where it is, because whatever is receded, as I said, the techniques are very difficult, can be done, but they're difficult. So the first aim, try and save what you have, make sure that it doesn't go anywhere further, and in case it is at a stage where it can be salvaged, there are mucogingival surgeries where we can cover the where the root surface back with the gum, so that you have it back.
So quickly, Rajkumar's question would be the last question that I can take today. How many times is twice a day dental floss enough and safest method to do the dental floss?
Um, yes, as I said, oral hygiene procedures have to be twice a day to make sure that you get the best out of not having gum disease, and those two should be at a 12-hour gap. When you're doing oral hygiene measures, you use the floss or the interdental brush depending on the space. The flossing also has to be twice a day before brushing, so that once the interdental area is clean, after that you can clean the regular tooth surface with a brush. Now,
All right.
floss, uh, I'd like to say, just remember three tips that I teach you. Tip number one, the floss length has to be about a foot long, not small. Two, you can only tie the floss on your middle finger. Middle finger.
Okay.
If you're
Not on.
if you're not doing it on this middle finger, it's like a cycle. You don't ride it properly, you'll fall down. So, people who are initially learning to floss get very frustrated. "ये हमसे नहीं हो रहा." It's because they don't follow these three tips that I'm giving today. You follow these three tips and do it regularly for about 15-20 days. And after the 20th or the 30th flossing, it'll be very easy. Initially, do it in front of the mirror. Take a foot long, tie it around the middle finger. These are two tips. Third tip is, if you're using close your hands after you've tied it, so it's right and stretched between your two teeth. If you want to go up, use your thumbs, and if you're going down teeth, use your forefinger. If you change this, let's say you're doing your thumb on one side and forefinger on the other side, like this, it doesn't work. So upper teeth, so first principle, 1 foot. Second principle, middle finger only. Only this finger. You tie it only on this
Yeah.
finger. After you tied it, you close your hands. Upper teeth go with your thumb. Lower teeth go with your forefinger. Follow these tips. Try and do your front teeth initially when you're trying to do that. Once you've done your initial teeth, and then you can go on to your back teeth as well.
Yeah, there are two more questions which I would want you to answer, but unfortunately I'm running short of time, so I'll not be able to take. Wisdom tooth का question है, nerve के पास है, expert के पास जाइए. That's what quick answer there. He has mandibular nerve के पास
You,
wisdom.
you, can, you can do a CAT scan to see कितना पास है वो. It's a miniature CAT scan which is done, and there are procedures where there are various ways of saving the nerve when you do that wisdom tooth extraction.
Yeah.
A CBCT or a cone beam CT will help you diagnose and help you with that problem.
Great. And Rajkamal is asking, after RCT crown जो है वो cap is ground, it's grinding हो गया इसका, flat हो गया. What can he do? One quick tip there. RCT के बाद cap लगाया उन्होंने, and then cap is
You
now.
will have to, if it is ground to, and there is बहुत ज़्यादा घिस गया तो आपको change ही करना पड़ेगा. You can't rebuild it in the mouth. You will have to send it to the lab. It has to be done.
Thank you. Yeah, thank you so much for the patience. Now I want you to give us top tips on how to maintain oral health hygiene.
Brush, brush, brush. But initially do your interdental cleansing and brush. And that's all I'd like to say.
It's really fast and quick. Thank you so much. So brush, brush, brush. दिन में 2 बार कीजिए. अगर हो सकता है तो floss भी कीजिए and take care of your health. That's what.
हो सकता है नहीं, करिए. Floss करके brush करिए. करिए.
ठीक है, brush तो होता है. हो सकता है तो floss कीजिए बोल रहा है मैंने. So but anyway, try and take care of your health. Thank you so much, Dr. Adosh, for giving your time on Sunday morning.
Thank you. Thank you.
Thank you, Namaskar. So that is a wonderful session, and I'll take leave from Dr. Adosh. Here are your coupons that you can use on Apollo 24/7 app. Download the app and use these codes. The code that you can get is AskDoc150, AskDoc150. Use this code to get up to 150 rupees cash back on consulting the doctors on Apollo 24/7 app. And then the next coupon that we are giving is First 3, FIRST3, use this code on Apollo 24/7 and you can order medicines direct from Apollo and get up to 25% off on online medicine orders. This is valid for the first 3 medicine orders which are 1,000 and above on Apollo 24/7. And Here's a coupon for Health Our viewers. This is an exclusive coupon code. Use the code HH247 to get up to $199 off on online consultations with Apollo doctors and up to 20% off on medicine orders as well. Thank you all for joining us today. Next week, we are going to talk about a topic which is fluctuating appetite. Too much or too little? What is your appetite saying, and how do you understand your appetite? Join us next Sunday, that is 18th December, 11 a.m. Do not miss the session. You do not want to miss this, then do subscribe our channel, and also there's a notification icon that you can turn it on, and then you will get a notification alert as well. Thank you all for joining us. And by the way, let me also remind you once again that Apollo 24/7 is just a call away. You can call or do WhatsApp text on 9355-247-247 to avail healthcare services that are available on the Apollo 24/7 app as well. Chaliye, thank you so much for joining on this Sunday morning. This was an interesting session. With your questions, you make this session even more interesting. Please do join us next week as well. Till then, take care.